So the next session and the last session for our Tanzania Summit will be Who is Who session. And today we have 3 presentations from different interesting organizations. And we do advise you not to miss these sessions. So as we invite other audiences to be joining us, I will introduce to you our esteemed speakers who will be presenting Who is Who sessions today evening. So number 1, we will have the presentation from Somoe Harifani Mohamedi. Somoe Harifani Mohamedi, please step forward. Somoe Harifani Mohamedi is a nurse officer, is set to deliver the presentation as a part of Nilax exhibition package on home-based care services in Tanzania. With the dedication to enhance healthcare and commitment to providing top-quality services, Somoe brings the valuable insights and expertise to the field. Karibu sana Somoe. Clap your hand to Somoe Harifani Mohamedi. And then the next presentation will be from George Tryphon. George Tryphon is the manager at Kairuki Green IV Laboratory, bringing wealth of knowledge and expertise to the field of Bachelor of Science in Medical Laboratory and ongoing pursuit of Masters in Biotechnology of Human-Assisted Reproduction and Embryology. So George will be presenting on basic diagnostic of female infertility according to WHO criteria. Karibu sana, George. Happy welcome land to George, please. So, and the last presentation will be from Dr. Musa Ndire. Dr. Musa Ndire is a seasoned medical doctor with over 17 years of experience in public health practice in Tanzania. Currently serving as the Director of Strategy and Performance Management at Benjamin Mkapa Foundation. Dr. George will be presenting on an overview of the country's initiative for sustainable and effective TB contact investigation, TIFA. Welcome, Dr. George Ndire on the stage. Musa Ndire, sorry. So, I hope we have our presentations ready. IT team, I hope we have our presentations ready. And we will be starting with Madam Somoe Harifani, who will be presenting on home health and rehabilitation services. That is ready, is Dr. Ndire. So let's start with Dr. Ndire. So Dr. Musa Ndire will be presenting on an overview of the country's initiative for sustainable and effective TB contact investigation, TIFA. Karibu sana, Dr. Ndire. The stage is yours. You can have a stage if you like. If you like to talk from there, it's fine. Thank you.
So, good evening. It's a bit tough when we are doing it at the last minute, but I hope we'll all understand what we are doing. So I'll be presenting an overview of the country's initiative for sustainable and effective TB contact investigation, an initiative that we are implementing at Benjamin Mkapa Foundation in collaboration with the government through the NTLP, PRAG, CSOs and other stakeholders. So next slide. So quickly to introduce Benjamin Mkapa Foundation is a non-for-profit organization which was founded by the former president of the United Republic of Tanzania, the late Benjamin William Mkapa. It was officially registered with RITA in 2006 with the name of Benjamin William Mkapa AIDS Foundation, and later changed to Benjamin Mkapa Foundation, BMF, in November 2015. So the change was just to remove and not to make like a exclusive HIV organization. So next slide. So that is our vision, is to have healthy lives and well-being for all in Tanzania and the rest of Africa. And we have our mission. Next slide. We are currently implementing our third strategic business plan, which spans from 2019 to 2024. We have the 3 goals. Okay, we have the 3 goals. Back, please. Yeah, too quick. Back again. Okay, we have the 3 goals that we're implementing. The goal number 1, which covers the strengthened systems to accelerate the attainment of the national universal health coverage targets. We also have goal number 2 about the use of intensified evidence-based approaches, but also goal number 3 on the enhanced institutional performance. So next slide. So we are in our 17th year. We celebrated during the month of April, and we have managed to implement around 36 projects from when we started as an organization. And for this fiscal year, we are implementing a total of 12 projects. So this project spans from the HRH projects, the projects which are safe delivery, but also projects which are focusing on some specific diseases. And today I only focus to the project which we are implementing, which focuses on TB contact investigation. Next slide. So we are implementing a project which will soon see the details, which we are providing technical assistance to the national NTLP to enhance the capacity of sustainable and effective TB contact investigation, which is funded by USAID through JSI. Next. So this is under the portfolio of TB Implementation Framework Agreement, TIFA. That is the overall objective. Next. As I said, we are funded by USAID through JSI, and we as Benjamin Mkapa Foundation, we are the primary implementer, but we are collaborating with NTLP, PRAG, IPs, CCOs, and the TB communities. And the duration of this project is 1 year, which will end in January 2024. Next. So that is just the context. We can see the recent data on the Global TB report of 2021, which is saying the incidence now is at 132,000 people who get infected with the TB, but we can see only 86,000 who are being notified and started on treatment, so the rest are not receiving. But we can see we are progressing well on TB treatment coverage, 65% by the year, last year, year 2021. But as a country, we're also doing very well in TB treatment success rate, because our target is to at least achieve more than 90%. Next slide. So I will not go to talk a lot about the treatment part of it, but now I'll only focus on the component that we as Benjamin Mkapa, we are implementing in line with this program that we are implementing. So the short form is TBCI. So this is the systematic process for identifying and screening previously undiagnosed persons with TB disease who need curative treatment, or with TB infection who need preventive treatment among the contacts of an index case. So we know some people will get TB infection and they'll have some contacts, someone whom they spend one roof in a day, like someone who sleeps in a house with that person who has TB. So these are the people who are at a high risk of being infected, and they need to be investigated so that we ensure that we confirm if they have not been infected, and if they're infected, we set treatment, and if they're not, we continue preventing. Next. So the way TB contact investigation is done, we are mostly using the community area, and we understand that NTLP, we have the community, the section which deals with community TB identification. So the existing guidelines and some policies and SOPs. So what we are doing as BMF, we are enhancing the existing initiatives to increase the TB contact investigation. Next. So we can see this is some of the report for the year 2022, whereby the investigation of the contacts was implemented, and we are seeing some good numbers. We are aiming to achieve 90% to 100% of investigating those contacts. So the green, those are the regions which have tried, but the yellow, we had some data issues there because some people had listed even the contacts who are outside. Yes, I'm winding up. So next we have the building blocks which are key for TB contact investigation, and next. So I just wanted to say, through all this process, because we know there are some guidelines and SOP that are existing, but we have done a good work with the stakeholders that I've said. We have already developed some of those tools, which are now still in English, and these are the ones which the next step will be translating them into Swahili, because the community health workers are the ones who are doing the contact investigation. So we are translating, but we will also be doing further dissemination while we are implementing the existing activities. So we thank all the partners that we're working with, whom we have been collaborating to ensure that we're improving and we're enhancing the TB contact investigation initiative in the country. Thank you.
Thank you, Dr. Musa, for that good presentation. And now let me welcome Mr. George for his presentation on basic diagnosis of male infertility according to WHO criteria. Karibu sana.
Thank you. Thank you very much. I think, firstly, when they are just displaying my PPT, my name is George Tryphon, as they introduced me. I'm a professional in ART. ART, we heard about the paper, they are talking about the ARV. They use ARV, so there are other things known as ART. ART is the treatment of social death, but ARV is the treatment of physical death. So we are talking about now social death. That the treatment we have is ART, assisted reproductive technology. Because people, they are suffering from infertility. You know, they have been talking here about HIV, but the main cause of the HIV now is infertility. Because people, they fear stigma. Social stigma is high for those people who are living with infertility, more than with HIV. So it's better you live with HIV more than to live with, to be infertile. If you lack child, means you will try every several routes to acquire this. So this is Kairuki Hospital, already installed the IVF department. I'm working as a manager there, but also I'm embryologist, the professional for these issues. And I have a master's, I introduced it. Come, next slide, please. Okay, so the objectives today, I will talk about the analysis of infertile men. How can you know that men are infertile? You know, most of men, they have child, but they don't have sperm. And unfortunately, they don't know if they don't have sperm. They don't understand it. They're not aware about that. But they still have a child. They are living with a child. So this we came with this most of a very crucial factor you have to do is to analyze the man if they have a sperm, and if the sperm can enable the partner to conceive, to be pregnant. Go next. We pass this topic. This is the definition of infertile man. Infertile man is the man who is not capable to cause the partner to conceive. That's the problem. We call about infertility. Next, the cause. I will talk just a little bit because the time is limited. The cause, many causes of infertility men like this one: poor lifestyle, poor nutrition, there are some activities in the society is not good. It just end up with infertile man, especially for young men. Now, if you check about 100 of men who visit you, more than 50 or to 60%, they are infertile. They have abnormal spermatozoa. If you have an abnormal sperm, means you will end up with infertile couples. Stop there, please. Environmental factors. We have a lot in our environment. We have a lot of exposure. The air is polluted. If you go to those people who are staying in industries, some work space, is not a favorable condition for the person to stay, because man, I was thinking to talk about, the difference between man and men and woman is that we have all system equal, but we differ in the reproductive system. That is right. The woman, their advantage is they born with their eggs, but the men, we are manufacturing, or we are producing the sperm each 90 days. We produce the next sperm each 90 days. So we have such intervals. It's our luck, we can produce lifetime. But the ladies, they decrease their eggs as they go at the age. They increase their age, so the eggs decrease by around 1 month. They can lose more than 1,000 eggs per month when they start a menstruation cycle. When they go to menstruation cycle, they lose more than 1,000 eggs per month. So when they grow, so their eggs decrease drastically. But men, we produce the eggs each 90 days. Each 90 days we change the sperm. Each 90 days we change the challenge we face is the factor. The environmental factor can affect the production, but also if you have stress, you will affect the production. If you got a hormonal imbalance, you will affect your production. Medical factor, if you go to those treatments like medication, whatever, you take a lot of medication irregularly, that you will end up with infertile men in the society. But also genetic factor, this is inevitable. You cannot stop that one. There is a lot of them. Most of them we acquire, most of them we inherit. But other things are disease. There is a lot of disease now currently going, especially sexually transmitted disease. They cause male infertile. But also immunity. There is a lot of people who are infertile because of their immunity. They don't know about that. The stress I already talked about. Overweight, idiopathic, unknown cause. There is a lot. Okay, next, ma'am. Next. The prevalence. What the prevalence now? Currently, it is lightened by WHO. More than 1.8% of men worldwide, they are contributing to the infertile couples. And now it's already calculated more than 48 million couples in the worldwide. They have infertile issues. So continue. Key point on sperm analysis. In order to understand how you can treat those infertile men, especially, the first point is better analysis. You know, most of people, they have been using a lot of money, going there and there, that's searching, treatment, and they've been taking a lot of supplement. You know the supplement, what the supplement about? Everyone gives supplement. There is in General D, there is in your life. A lot of people, they just give money, supplement. What is supplement? Supplement is just a little bit. It's about nutritional factors. If you go to somebody like is infertile, but in issue of genetic issues, if you give a lot of supplement, whatever you give with 2 tons, you can't treat, you can't help that man. You will be suffering mentally, you'll be suffering physically, but also financially. You can't treat. So our aim as Kairuki Hospital is to spread this education to the society, especially those providers. As the last months we did this one for most of gynecologists, we've been training them in order to provide the right treatment, in order to provide the right diagnosis. Before you say this man is infertile, this man is incapable to make the pregnant our partner, you must have a proper treatment. You must have a proper diagnosis to confirm what the reason. Is this genetic? Is this environmental factor? Is this hormonal? Is it stress? Because most of men now, they have stress. The stress, they end up with infertile, but they got child. And we are lucky that we got a woman, we got married with the faithful wives. But if you have an unfaithful wife, you end up with getting child, but you don't know it's not yours, actually. It's not yours. And you don't know, actually, if you have low count sperm, if you don't have sperm, you don't know. But you go give money, take them to school. It's just a normal behavior, because we fear stigma in the society. As a man, we fear to be segregated. I can't get we always use dirty we call a habit of what men we have, like, like that way. So we don't want to say the truth as the man. We keep segregating the woman. We keep chasing them away. So what the woman do? What the woman do? If you segregate the woman answers by action. They try here and there. Unfortunately, or lucky enough, they will not acquire HIV. If they got HIV, it's another result of yourself. So we are just trying to give this education to the society, and we are just trying our capable, but now the problem of this thing is very expensive. The problem of this is very expensive, and no any organization the worldwide that support or they can just invest on these things, because if you try to treat those infertile couple, is not less than 5,000 or up to 7,000 US dollars in Tanzania or in Africa. But if you go to abroad, it's more than 20,000 US dollars, up to 10,000 to 20,000 US dollars you have to pay for treatment, but still the result is about 40% to 50%. You understand? So it's not actually 100%. Still, it's very expensive. So what it has as a society and as the stakeholders in health issues, we just emphasize you that let's keep acquiring the best knowledge about these things. Let's share the idea we have. Let's teach our young men. Let's teach our younger students. Maybe we can visit in the students or in the educational facilities, who are just maybe anything I can say about this one, because the time is too much limited. I think 10 minutes is not enough for this to speak in front of you, but let me conclude by saying that, please, men, let's support our wives to check about infertility. Infertility is growing very high, more than HIV. And
thank you.
We call it, let me finish. We call them, take these things, take this point. This is very important. This is the social death. This is the social death. In the UK, in maybe Europe, 1 child out of 5 are born by assisted reproductive technology. So thank you very much. This is not enough for me to talk about that one, but
thank you. Join hands for Mr. George. Thank you for this good presentation. Karibu sana, karibu sana. Thank you so much. Now, Mr. George's presentation will take me to Madam Somoe Harfan. So Madam Harfan will take us through home health and rehabilitation services. Thank you so much. Karibu sana.
Thank you so much. Good evening, everyone. Before I start, okay, my name is Somoe Khalfan Mohammed. I'm coming from Nilax Home Health Care. How many of you have ever heard in Tanzania, like, we have a home-based care? Raise up your hands. Just 1 and 2. So Nilax Home Health Care, we bring hospital at your home place. So according to the WHO, it says that approximately it's expected that by 2030, more people will be at risk of developing chronic diseases like cancer, diabetics, hypertension, and whatsoever. It also says that approximately by 2015, there will be 2 billion of people over the age of 60 years, with 80% of them living in the developing countries, that is Tanzania being included one among them. So home-based care has currently become one among the alternative solutions to the hospitals, because for the patient, home is a place where emotional, physical associations, memories, and comforts is provided. So as a Nilax Home Health Care, we decided to come up with home-based care services at clients' home. So we help individuals have safe home with the comfort, independency, with the dignity. So basically, we provide the nursing and midwife services at your home place. We provide our services 24 hours a day and 7 days a week. So what makes us Nilax special is that we provided our services with compassion, excellence, and reliable within the comfort of our clients. Can we see the presentation? Okay, that's good. So looking into the situations of Tanzania and of the home-based care services, we didn't have home-based care services, as he said. I think we are the first company to be registered with the Ministry of Health and also with the TNMC, Tanzanian Nurses and Midwives Associations. We got our registration last year, November, so we started to operate officially to provide these services at home. So our services has been categorized into two aspects. We have nursing services, but also we have rehabilitation services. When we are talking about nursing and midwife services, we include all the services that includes medical consultation at your home, administrations of drugs if you have any injections. We also the wounded dressing if you need to be monitored vital sign, that is blood pressure, monitor your blood sugar, your pulse rates, your respirations, your blood pressures, everything. We can also do it at home. But also we do care for elderly at home. If you have an old father, mother who is at home and then they don't have a person to taking care of, then you can obviously reach to us, then we can provide the services for 24 hours at your home. But also we provide ambulance and first aid services. If the patient has the feeding tube, the catheter tube that it needs to be cared, then we can always be there to do that procedures. But also we care for mothers and their children. We know that most of the women, they after delivery, they just go home. Sometimes they are themselves. So they need a medical personnel who can be there to look after them and also to look after the children, to making sure that if the wound is being dressed, the medication are being taken on time, and also if there's any danger sign like PPH, it can occur, then the nurse or a midwife will be there to provide the services. But also we provide the post-operation care, all types of operation of the surgicals that the patient is undergoing. So after discharge, we taking care of that patient at home. But also we have another package of physiotherapy. Sometimes we say a patient, you are living at Mbagala, then you're going all the way to Moi to do the physiotherapy. But you can call the Nilax, then we can come all the way to Mbagala and do the physiotherapy at your home. So all the services that were supposed to be provided at hospital, then Nilax, we can provide them at your home. So another aspect that we're basically doing as a Nilax, we involve ourselves in community involvement like NCD screening, but we also have package of companionships. Sometimes your parents is alone at home, so they require a person who can be there, making sure that they're doing the exercise, they're eating well, they're dressing well. So all that package we can also do, Nilax can help you. But also we provide homekeeping assistance. We have a trained aider. Imagine having housemates who knows how to cook, wash dishes, but they don't know how to taking care of you in case of any emergency happen. So as a Nilax, we have aiders who will be making sure that they cook, they do laundry, but also in case of any emergency, they can be there to help you out. So we also provided training. We have a training packages. We train different organizations. It can be house, family, it can be schools, it can be the apartment. So anybody who feel like they need to be trained on how can you taking care of the patients after being discharged, especially the bedridden patients. So our team has comprises of different health categories or different health professionals. We have nurses under all the specialties. We have mental health nurses, we have pediatric nurses, we have oncology nurses, but also we have all varieties of doctors that you require, but also we have a physiotherapy. So we're making sure that our services are being satisfied and are also meet our clients' needs. As a Nilax, we believe that multidisciplinary approach is the key to better home services. So we put the patient at the centers, and then we're making sure that all the services, all the needs that the client needs is being reached at their client's home. So what makes us Nilax special is we provide our services with compassion, excellent reliability within the client's home. At first, as I said, we got registration last year. Till now, we have been able to reach 100 patients. So we are still needs, we don't say that we still need more patients, but we still need to serve as much lives of the patients as possible. I'll say, to end up this, I would like to tell you that our scope currently it's in Dar es Salaam, As we are looking, we'll be expanding all over Tanzania, but now all over district in Dar es Salaam, we can be able to reach all the clients within 24 hours. Currently, our office is located at Kijitonyama near the Akiba Bank, and we provide our services 24 hours. These services, as I said, it's new in Tanzania. So basically, the NHIF does not cover the services that we provide, so the patient has to abide to the package that we have so that we can provide those services. So welcome to Nilax Home Healthcare, and we are ready to serve you all.
Thank you so much, Somoe, our very own nurse. And this takes us the end of Who is Who session. Who is who? Thank you so much to our esteemed speakers. Thank you, Dr. Andire. Thank you, Somoe. Thank you, George. It has been a nice presentations, and unfortunately, we do not have questions for this session. Thank you. Welcome to the closing ceremony of Tanzania Health Summit. See you there. Thank you. You will have a chat.